With around 182 million inhabitants, Nigeria is the most populated country in Africa. It currently ranks amongst the world's fastest growing economies. But back in 2008, one of the biggest threats to its economic success was malaria.
Malaria was, and still is actually, the single most important public health problem in Nigeria.
In 2008, in every minute, a single child will die of malaria. That contributes to around 26% of the global death of malaria in the world.
Malaria has always put a huge strain on public health and the economy in Nigeria. In addition to costing the country around $1 billion a year, the disease is responsible for well over 100,000 deaths annually, stretching the health system beyond capacity.
You can imagine if 60% of outpatient cases that come to you have malaria, it means for the health workers it's huge. Draining the economy of the country, killing Nigerians, and reducing the capacity of Nigerians to attain their full potentials for the future of this country.
8 years ago, Nigeria's health system was under immense pressure. Something had to be done. In 2008, under the leadership of Malaria Consortium, the Support to National Malaria Programme, or SuNMaP, was launched, with the help of partners Grid Consulting and Health Partners International.
Let us get set with this. We have a lot to do this week.
A summary of what SuNMaP is all about is put in its name, and is to strengthen the capacity of the government of Nigeria to respond to the burden of malaria.
Since the program began, Malaria Consortium has worked closely with the government's National Malaria Elimination Program, bringing together national and international partners.
NMEP was set up to coordinate all malaria control activities in the country, ranging from all levels of government and development partners, NGOs, civil society organizations, and all the other partners, including the commercial partners.
SuNMaP wasn't designed to be the largest malaria program, but it was designed to leverage the efforts and the contributions of others and to bring them working towards one goal.
With funding from UK aid, government and donor resources were put into immediate action.
The states, SuNMaP, and all the other partners got together to decide what were the gaps identified within the states. How could we as partners help draw up a plan as to what each person was responsible doing? And I think that helped to harmonize our funding and to be able to use them judicially.
We are the ones managing our own funds. We are the ones ensuring that things go according to plan, based on the plans that we have on ground.
With a plan and strategy in place, SuNMaP rolled out a series of campaigns that would eventually cover 10 states across Nigeria. This involved the distribution of 7.4 million nets and mass sensitization on their use. By 2013, the net campaign had successfully increased ownership from 7% to 49%. At a grassroots level, over 23,000 local health workers also received training that was tailored to the needs of each region.
We don't prescribe, we will facilitate, We believe in an inclusive process, and we believe in taking feedback from a large group so that by the time you have endorsement from a wider group, the initiative in question is more likely to thrive and survive than when it's something that people are not aware of and they're likely to kick against it.
SuNMaP have been working in Niger State for the past 6 years now, since 2009. As at that time, when SuNMaP came in, malaria was just like that for us. Nobody supported. So the coming of SuNMaP, it was excellent for us because in all areas, in terms of prevention, in terms of cure, in terms of health system strengthening, SuNMaP was all in these areas.
In the past, before the arrival of SuNMaP, coordination was a bit difficult because there was no plan on ground. But with the operational plan that was actually driven by SuNMaP project. The activities of all the partners I coordinate so that we don't need to duplicate our activities in Niger State. We bring them together through the same channels. That is the antenatal care services channel. Malaria in pregnancy is key. And that has really helped us because SuNMaP have actually supported the coordination to see things being done not haphazardly, but in completion, in totality. And then you have the capacity building to go with.
With Niger State alone spanning more than 76,000 square kilometers, training has been an essential element of the program as an effective way of cascading learning and enabling health workers to deliver an improved service in some of the most remote areas of Nigeria.
The next topic will be on preventing malaria in pregnancy.
Nets have been given. SP-SuNMaP perimetamine has been given to these facilities. And for the people that are seeing the client, they need to be well oriented and well trained on how to give it and give it appropriately. They are being trained so that they will be able to pass this information across to their subordinates too. And if this happens, we believe that this will go a long way in getting the critical mass of people that are needed.
If there's a new information, we can be told so that we can also communicate it down to the community for their own benefits.
Armed with this knowledge, frontline workers have been able to return to their communities and make sure everyone benefits from their training. With a population of around 18 million people, Lagos is one of the fastest growing cities in the world. This rapid growth is putting health centers and hospitals under a huge strain. For doctors at the antenatal clinic, investment in staff training has given them new hope.
Support for National Malaria Program has been a wonderful input for service delivery in Lagos State. They build you such that you are just built, you know, and you are made to impact others. Because you are pregnant, I am a wealth that SuNMaP has created in terms of giving knowledge about how to control and manage malaria.
They gave us anti-malaria drugs and all that, so they take care of us here very well to prevent malaria and other things.
Throughout the pregnancy, I don't have anything malaria, and when I born my baby, nothing like that. My baby malaria free. We are all well okay.
However, it was recognized that while targeting vulnerable groups like pregnant mothers and children under 5 was a high priority, the elimination of malaria would require a far more comprehensive approach.
To eliminate malaria is not enough for you to be free from malaria. It means everybody has to be free from malaria, because if 1 or 2 persons still have parasites in their blood, that person is still a source of spreading malaria to every other person.
One strategy was to pilot an alternative way of accessing communities who wouldn't normally come into contact with the health authorities.
The school net distribution project was actually born out of the fact that the normal routine channels that we've been using through the ANC was not enough.
Class rep, write down the names. How many of you have been sleeping inside mosquito nets?
We saw students as change agents. This, of course, entailed doing some kind of training, materials that talk about what malaria is, which the teachers could actually use in educating the students.
I want somebody to tell me something about malaria. You.
Malaria is a serious illness caused by mosquito bites.
Some believe that if children are used to get the net home, the whole family will use it, because they are in a better position to convince their parents and their neighbors to use it.
I was able to define what malaria actually means, and I was able to convince them about the usefulness of using mosquito nets and how it prevents us from falling a victim of malaria.
In working towards the elimination of malaria, SuNMaP recognized that the only way to create a sustainable solution was to move beyond the public sector and create an attractive proposition for the commercial sector.
The important thing is with the donors giving products in the public sector, there has to be an exit strategy for the private sector to take over, which we haven't been able to do ourselves. So SuNMaP came to help and see how they can support us to achieve that.
SuNMaP helped companies in Lagos to market their products beyond the healthcare system to private pharmacists, and from there to the public. This would capitalize on awareness already raised by the National Malaria Elimination Programme's Test Before Treat campaign.
The anti-malaria commodities have been distributed publicly, but we've also enhanced the sales of those through the commercial sector. So basically dealing with all the market inefficiencies to be able to encourage distributors of anti-malaria commodities to be interested in the trade, which is what in the long run will be sustainable.
You need to create the demand for the patients, and then you need to make it profitable for the retail outlets. And working from the two sides have really helped greatly.
One of the key successes of this partnership was increasing the uptake of rapid diagnostic tests for malaria, or RDTs, by private vendors and the public. Helping to build the demand for these quick and reliable diagnostic kits encouraged distributors to enter markets they had previously seen as unprofitable. SuNMaP identified private pharmacists as a pivotal group in their communities and undertook a training program that successfully increased the use of RDT and reduced the use of anti-malarial drugs when they were not needed. After training, local pharmacists like Sani can take home a new approach to their work and hope for their communities.
Malaria symptoms you have, other diseases might have the same symptoms. Then if you are tested positive, then we'll now give you ACT.
With SuNMaP back in the private sector, patients are beginning to now understand that you can trust our data. There's more confidence now in the malaria test kits than ever before.
So you don't have malaria.
Thank you. Maybe I will go to hospital.
They say knowledge is power. Because we did not have that enough knowledge, we have been making mistakes. But all this training have brought us back to do it right.
8 years on, and SuNMaP has helped develop a solid malaria control infrastructure, a viable business model for the commercial sector, and has successfully brought all partners together, moving towards one powerful vision.
SuNMaP has helped us in the area of coordination, which is actually the main basis of our existence at the National Malaria Elimination Program.
It has helped us greatly. I will not forget them for that.
On the 5 mortalities in Nigeria, we have contributed to over 48,000 lives saved.
It gives one joy that our patients are no more dying. Mothers are seeing the joy of their labor. It's wonderful. And so we thank SuNMaP for opening the lead way for us to see that it is doable.
The next challenge in the journey towards the elimination of malaria is to build on the progress achieved under SuNMaP and extend this to other parts of the country. Only then will we be on track to bring an end to malaria in Nigeria.
I see the same world from a different angle. I see a situation in which when my children are being born, they can live in a Nigeria that is free of malaria.